Hello, my name is James Wu, and I'm a current hematology oncology fellow. I am at the Medical College of Wisconsin, and my interests in research are in health disparities broadly, as well as global hematology oncology. Just wanted to take the time to share a little bit about our paper here and what led to this paper. So this paper is looking at, global leukemia outcomes in both pediatric and adult patients, and it's looking at national cancer system metrics. The reason why we chose leukemia is because, globally, 500,000 individuals were diagnosed with leukemia just in 2022 alone. And in that same year, leukemia was among the top 10 causes of cancer death in 71 countries in adults, and the leading cause of cancer death in 96 countries in children. But we do know that there's still a lot of disparities. So lower and less resourced countries have higher disparities and worse outcomes. And while these disparities are well documented, it's less clear, how we can use health systems and what metrics can be levered to improve these disparities. So that's where the impetus for the study started. And in terms of what data we used the GlobalCan 2022 database, and that has global estimates of cancer incidence and mortality. And these estimates are produced by the International Agency for Research on Cancer, which is a agency as part of the WHO. And through these publicly available data, we were able to calculate mortality to incidence, age standardized mortality to incidence ratios. And these ratios are easily accessible and used and can compare easily across countries. And they serve as more of a high level indicator of inequities in cancer outcomes. And that's why we chose to use the mortality to incidence ratio, or what I'll refer to as MIR. And in total, we looked at many different health system metrics, and we looked at a total of 13 for adult and 11 for children specifically. We looked at things like the health spending as a percentage of GDP, physicians and nurses per 1,000 population, bone marrow transplant services, RT or radiotherapy centers per 100,000 populations, as well as the universal health coverage service index, pathology services, human development index, and then gender inequality index. There was also GDP per capita as well as out-of-pocket spending. And there were two specific metrics looking just for pediatrics, defined childhood referral patterns as well as childhood early detection programs. To highlight kind of the overall findings, the main takeaways of our paper on multivariate analysis or multivariable analysis for pediatric patients only. So we classified that as from ages 0 to 19. The only metric out of all 13 that we looked at that was significant was the gender inequality index. And to give you a little bit of background, the Gender Inequality Index was published by the United Nations Development Program, and it provides a way for us to assess gender inequalities. And in particular, it's relevant to the Sustainable Development Goal 5, which is put together by the United Nations. And that goal is achieving gender equality and empowering all women and girls. And this gender inequality index is a composite metrics, and it incorporates three dimensions. One is reproductive health, empowerment, and then the last one is labor market. So, it might be surprising, and you might think, why would gender inequality be associated with worse leukemia outcomes in children? You think about, high gender inequality limits the ability of women to act in the best interest of their children, and it results in worse health outcomes overall because of that effect. And from data from the WHO, nearly half of married women lack decision-making power over their sexual and reproductive health rights. And one can imagine the cascading and downstream effect that can have on the children's health. So really, the Gender Inequality Index was a surprising finding in this study for pediatric leukemia outcomes because typically it hasn't been linked and you wouldn't think it would have an association with leukemia outcomes, but here it does. And previously, this gender inequality index has been shown to lead to worse child mortality as well as malnutrition. But our study is the first that we know to link this index to worse pediatric cancer outcomes. So that was one of the most important findings of the pediatric side. Of course, on univariable analysis for pediatric patients, all the metrics were significant, and it's still important to develop bone marrow transplant services, especially in resource limited countries, and really partnerships between resource rich countries that have experience in bone marrow transplant and countries developing these systems would be important moving forward. Moving a little bit to the adult side, when we looked at multivariable analysis, there were a couple of findings that were significant as improving the MIR ratio for adult leukemia. One was healthcare spending as a percentage of GDP. The other was nurses and midwives per 1,000 population. Then we also have the Universal Health Coverage Service Index, or the UHC index, and then also the availability of bone marrow transplant services. And the last two were the GDP per capita, as well as out-of-pocket spending as a percentage of current health expenditure. So out of these findings, there were a couple that I wanted to highlight, specifically, the UHC index. So again, talking about the United Nations Sustainable Development Goals, the goal number 3 is actually ensuring healthy lives and promoting well-being for all ages and all people. And one of the key aspects of the Sustainable Development Goal is actually achieving universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines. So this UHC index is a composite indicator, and it's designed to measure progress towards this goal. So we found that higher progress towards UHC is leading to improved adult leukemia mortality to incidence ratio. That was one of the big findings, I think, for the adult population. Similarly, we also found it was important that we need to strengthen the diagnostic and treatment capacity while also increasing adequate human resources. So we want to bolster the oncology nurse workforce, as well as increasing the capacity for bone marrow transplant globally, being an essential component in treatment for a lot of leukemias, especially in research limited countries. So, in the combination with, the increasing universal health coverage, as well as increasing diagnostic capabilities and treatment capabilities and workforce capabilities, those are really important factors that we found. And I think the big takeaway from this paper is that this analysis is exploratory in nature. So really, we have to do more work and to figure out exactly how we can intervene in these specific health system metrics. And key moving forward will definitely be global collaboration and kind of spreading the knowledge of how to implement successful leukemia treatment programs around the world, and getting access to medications, as well as coverage of those medications and, doctor visits and treatments and things like that, that are essential. So thank you again for listening.